Today we are going to discuss a very common metabolic disorder. It is diabetes. Diabetes is associated with deficiency of insulin, either the deficiency or the resistance in the body. We will understand what is chemical nature of insulin, from where it is releases, and what are the different physiological function of insulin hormone in the human body, and what are the different types of diabetes and medication we use in the treatment of diabetes. So first of all, we start with the insulin. Insulin is a polypeptide hormone. It is produced by the beta cells of Langerhans of pancreas. Pancreas is a mixed endocrine gland. It releases enzymes and hormones. It has profound influence on the metabolism of carbohydrate, fat, and protein. It is concerned as an anabolic hormone. It was the first hormone to be isolated and purified and synthesized. First hormone to be sequenced, first hormone to be produced by DNA recombinant technology. Now we talk about the structure of insulin. Human insulin contains 51 amino acids arranged in two polypeptide chains, chain A and chain B. Chain A contains 21 amino acids and chain B contains 30 amino acids. Now the secretion of insulin. Langerhans contains three type of cells: beta cells, alpha cells, and delta cells. Beta cells releases insulin, alpha cell releases glucagon, and delta cell releases somatostatin. Somatostatin is a universal inhibitor of secretory cells. Insulin reduces the glucose level of blood, and glucagon increases the level of glucose in the blood. So they work in opposite of each other. Insulin convert the glucose into glycogen, and in the form of glycogen is stored in the liver, and glucagon just do the opposite of insulin. It converts the glycogen into glucose, and glucose is the energy molecule of human body. And in case of resistance of insulin, body is not able to utilize the glucose, and lack of energy is there in body, and we feel tiredness, and there are a lot of symptoms appear as a clinical manifestation in human body. Now the hormonal regulation: alpha cell glucagon, beta cell insulin, and D cells somatostatin, and these hormones work together to maintain the homeostasis of glucose level and energy production through the different biochemical reactions in the human body. Now we move to the synthesis. Gene for the protein synthesis is located on the chromosome 11, produced from the beta cell of Langerhans of pancreas. Synthesis involved two precursor for insulin. First precursor is pre-proinsulin. It has 108 amino acids, and proinsulin, it has 86 amino acids. Now the effect of insulin on the targeted tissue: it provide effect on adipose tissue, muscles, and liver. On adipose tissue, it decreases the lipolysis. Lipolysis means breakdown of lipid, and it increases the glucose uptake. It is very essential for energy production, and oxidation of glucose produces energy in the human body, and it is stored in the form of ATP, tri amino and lipogenesis is metabolism of lipids. And on muscles, it increases the glucose uptake and glycogen synthesis and protein synthesis. In liver, it increases the lipogenesis and glycogen synthesis and gluconeogenesis. Now degradation of insulin: its half-life is just 5 minutes, and the protease enzyme, namely insulinase, degrade the insulin, mainly found in the liver and kidney. Now we see what is diabetes. Diabetes is a condition of elevated blood glucose level. It appears in the urination. Now it has two types. Type 1 diabetes, it's called juvenile diabetes or childhood diabetes because it is sudden and onset and patient's age is less than 15 years. Lack of function of pancreatic B cells due to the cell mediated autoimmune response. It destroys the beta cells. So the beta cells is not able to produce enough insulin, and due to the lack of insulin, type 1 diabetes occurs. And lack function of beta cells, preventive mitigation of elevation of glucose level and association with insulin responses, and it is controlled by the insulin injections. And the type 2 diabetes is most common after the age of 40 due to the obesity and the hustle bustle lifestyle, and if someone takes excess of carbs on the daily diet and not perform any physical activity, so the carbohydrate metabolism is completely disturbed and it causes the type 2 diabetes. Now the adverse effect of insulin. Hypoglycemia is a condition of low sugar level in the blood, allergic reactions, and lipodystrophy. Insulin resistance. Insulin resistance is a condition in which the insulin is not able to bind with the receptor, and insulin actually opens the glucose channel for entry of glucose so that oxidation can take place. And next is hypokalemia. It's a condition of low calcium level in the blood, and due to diabetes patient gain weight, put on weight. So it's a common symptom of diabetes. And glucosuria is also very common, and thirst and hunger, it is increased. And polyuria, it means frequent urination. So these are the common clinical manifestation of diabetic patients. So now we have completed with insulin hormone. Thanks for watching.